the reality of what we're dealing with today is we have a significant toxicant load. Anyone who was born before 1990 has a body burden of lead just because of when they were born, right?
Right.
In addition to all the other chemicals that are in our environment. And we have this, I'm going to say tsunami, we can use other words, of both mold exposure and mycotoxin exposure as a result of residential and commercial building problems that we have with our building industry that allow for mold growth. And then we have Lyme disease, which is an ever increasing epidemic as a result of global warming. You know, I live in Colorado, and we've never had ticks until 2 years ago. We now have a tick problem. We now have Lyme disease in Colorado.
Right.
Yeah, even at high elevations, you know, 9,000, 10,000 feet up in the air, it's warm enough now to have ticks. And so we have a whole kind of a new problem that we're having to deal with. So this combination of toxicant exposure and chronic infection makes practicing environmental medicine even more challenging. So thus, even greater need for that specialty education. But getting to today's topic, which is detox, what is it, right?
Right.
I want to start out with just a little bit of my perspective on this. You know, we know that the actual acknowledgement of environmental toxicants causing disease has been in medicine since the 40s and the 50s. We have pioneers in this area who were MDs, medical doctors, Herbert Wrinkle, Theodore Randolph, Dr. Randolph, who actually were some of the first doctors to realize that pesticides were hurting people. Remember DDT, we've had that, you know, that was available back in the 30s, 40s, 50s, 60s, and wasn't even taken out of commerce until 1972. So we have a long history of that toxicant and a lot of exposure. However, due to some pressure by the chemical companies, these doctors were basically not listened to, and their assertion that toxicants cause disease was really downplayed. And even our very own kind of modern father of environmental medicine, Dr. William Ray, who was a cardiothoracic surgeon, as well as running a hospital for environmental illness or patients who had been environmentally poisoned, he was also, he had a difficult time getting the attention of the medical profession. Certainly because I think we've had this long-standing, and I want to say, an actual overt and conscious kind of pressure from the chemical industry to downplay this relationship, right? So for those of us that now are paying attention, even though this downplaying of the importance of our exposure to toxicants on a daily basis is still happening from, I'm sad to say, you know, even the more astute and educated aspects of the conventional medical profession. I think there's so much information out there about our exposure levels that the general public is very clear that there is a constant and continuous exposure that we all have to chemicals every day, and that those chemicals alter our immune systems, our reproductive systems, our nervous systems, our endocrine systems, and our, well, basically every system of the body. You know, there's no system that gets away without being affected.
Right. And so the patients that I focus on have complex chronic illness. They come to us with longstanding Lyme disease or tick-borne disease, mold, mycotoxin illness, and then those wastebasket terms, right? Chronic fatigue syndrome, fibromyalgia, where the doctors don't know why they have to put this label on the patient. Autoimmune conditions, for example.
Depression that does not respond to standard treatment.
Exactly.
Big one.
Yeah. nervous system dysregulation, mast cell activation syndrome. Most of my patients have all of this all at once. And of course, I'm testing their toxins, their environmental toxicant loads. I'm looking for metals. I'm looking for pesticides, insecticides, glyphosate, and I'm looking for their infections. And of course, I'm seeing high environmental toxicant loads in this patient population. And once I begin to detoxify them in a way that's personalized for the patients, I can see that they're actually able to handle treatment of the infections, or sometimes even their infections start to go away if I detox them first. Now that's immune regulation right there, just by detox. Tell us about the research on environmental toxins and their contribution to immune dysregulation in complex chronic illness.
All right, well, where I would love to start, it looks like you need to enable participant screen sharing for me, Dr. Parpia, just so I can share my screen. Where I would like to start is by telling everyone out there that the federal government, your tax dollars, funds the Center for Disease Control, which has a huge database of toxicant exposure in the general population. So you actually have access to this. It's available to everyone. You can look it up. Let me share my screen with everybody. And I'm going to take you to what is called the National Report on Human Exposure to Environmental Chemicals. Now, this has been ongoing for 2 decades. It's a huge amount of people. Every 2 years, they actually have huge buses that go out all over the country and collect urine and blood from people like you and me. Large groups of people, 5,000 people, 7,000 people. And then they look in the blood and urine of those people for over 200 chemicals. And it's in this database right here. So if we go to this page, which is cdc.gov Exposure Report, it's the index for the exposure report. And we go to the actual data tables, which are in this beautiful little searchable database right here. And we look for, let's say lead. That's a good one. And we want to look for blood lead from the year 2011 to the year 2018. So those are the years in which data was actually collected from, as you can see, sample sizes as large as 8,000 people. And that was for the years 2011, 2012. We have actual information about blood lead on these individuals, right? So here's the important thing. We know from epidemiologic studies that have looked at this database for 19 years. So there's actually a recent study that was published in Lancet Public Health by Dr. Bruce Lanphier, who is a career public health epidemiologist. He specialized in lead poisoning in children. We know that levels as high as 2.6, I'm going to say 2.6, increased risk for dying of a heart attack or dying of a stroke, significantly. Dying of a stroke more than twice the risk. So just having a blood lead level over 2.6. Now, what I'm going to show you here is that there's a significant amount of the population that has a blood level over 2.6. And they are here in this group, and you can see that, right? You can see 3.16 back in 2011 up to 2.4. But, 2.4 is the average, and it goes all the way up to 2.6. The 95th percentile just means the top 5% of the population. Now, when you go in to get your blood drawn and you say, hey, I was born after 1990 and I just saw this webinar where this doctor talked about, and this is, I have people in academic centers that have agreed with me on this, that anyone born after or before 1990 has a significant body burden of lead that increases their risk from dying of cardiovascular disease. And I want my blood lead level drawn, please. It is a test you have access to. Every lab in the world does it, and it will cost about $50 out of pocket if your insurance doesn't cover it. your physician may say, I have no idea why you want that. I've never read that study. And that's because most doctors don't read these studies. They have no time to read the medical literature. And, toxicology, environmental toxicology, toxic metal research is not their thing. But it is true that everyone around the globe has a body lead burden historically, because we put lead in paint and we put lead in gasoline. And when gasoline was combusted or paint chips became dust, that created a global burden of lead. So it's in the atmosphere and it's in the soil, and it is in old buildings that were built before 1982. So this is a government database that has over 200 chemicals in it. So if you're exposed to a chemical, you can get a pretty good idea of what the average American level is in terms of blood and urine. So not hair and not stool and not tissue. The CDC doesn't measure those, but they definitely measure blood and urine. So this is an open access database. I don't have any secret passwords. Everyone has access to this. Every physician has access to this. They just don't know how to use it, and they don't know how to interpret the data in it. And that's what we teach our doctors to do, so that when they do have patients that they suspect, for example, I'll give you a great example of a patient, a woman who had an old home. She has four children, ages 2 to 15. She had painters come to paint her home because the paint was chipping and they really needed to repaint the entire outside of the home. According to the law, when you have an old home and you're going to repaint it, you have to bag that home. So you literally put a plastic bag around it so that all of the dust from the paint that you're sanding off gets captured, because that dust could have lethal levels of lead in it, right? So the company was not up to snuff in terms of following the law, and they did not bag the house. So there was a lot of dust that was breathed in by she and her entire family during that week when the entire house, was a big 2-story house, was sanded. And her blood pressure went up significantly. And one of her children became very sick. He got headaches, he was lethargic, he got stomach aches. And because she was paying attention, took her entire brood into the physician and kind of forced them to do blood lead testing. And her lead level was 45. Standard lead level is between 0.5 and 1.5. That's the average here. You can see the geometric mean for 2017, 2018 is 0.7. So this was, many, many, many times above the average. So both she and her children had to actually be treated for lead toxicity. This is not an uncommon occurrence.
No, I see my patient population. In fact, I've had many patients come to me. They're in a state of chronic Lyme all of a sudden, but likely is that they had the tick bite a long time ago, but their immune system was able to keep that Lyme in check, as the immune system should be able to do that. But they lived in the house when it was being renovated, or they moved back in 3 days later, test their blood lead, it's high, and do some tests to look at chronic Lyme. I'm looking at T-cell tests, not just antibody tests. And sure enough, they're fighting Lyme right now, and they have a high blood lead, but they weren't fighting Lyme prior to moving back into the house.
It's really great that you bring this up, Dr. Parpia, because we think of lead in kind of toxicologic terms, right? It has the capacity for causing cardiovascular disease. There are neurologic or brain-related problems with lead, and it can cause abdominal pain as well in an acute setting. However, lead also has an effect on the immune system. There was a great study done in Poland where they looked at levels of lead in utero, so in moms who are pregnant. And then they followed those children up until they were 9 years old. The children that were born to the moms who had the highest level of blood lead had significant risk for severe allergies. This was, I think the study was done in the 90s, so a little while ago, but not that long ago. And this is a connection that most doctors don't make, is that these toxicant exposures are immune toxicants and affect the immune system. You know, even in the reason I brought up the mercury tables here is that this is another metal commonly found high, especially in patients who eat fish. The US Forest Service did a study of all the inland lakes and streams in the United States in 2011. They published this study, and they found out that 50% of all the fish, we're not talking about the big ocean tuna or the big ocean shark or the big ocean other fish that are high in mercury, like swordfish. These are inland fish like trout and bass. And they found out that 50% of the inland fish had levels of mercury or a chemical called PCBs that were higher than the allowable EPA level in fish, right?
And this includes wild fish. My patients will say to me, I'm eating wild fish, though. Shouldn't that take care of it?
These are all wild fish. These are
Right.
lake, stream, reservoir, and creek fish. And, you know, I paid attention to that because I was very tuned in to fish as a source of mercury. So here we are, again, the Environmental Protection Agency, as an agency, you can see, oh, look, levels of mercury in people are rising. They're not going down over time. So if you look at the population from 2009 to 2010, which sadly is the latest data that we have, it's 10 years old, you'll see that in the top 5% of the population, levels of mercury are over the safe level that the EPA actually allows for blood mercury. So 5.0, and this is microgram per liter whole blood, is the top. In other words, it's, you can't have blood mercury over 5.0, but there you've got it. 5% of the American population is actually mercury toxic. Now, as a physician, I know that the data shows me that levels as low as 1, which is somewhere in here between the 50th and the 75th percentile, so at least 25% of the population has blood mercury levels high enough that it can alter thyroid function. So we know that thyroid disease, autoimmune disease, Hashimoto's thyroiditis, Graves' disease, or autoimmune thyroiditis is a huge problem in the United States of America, as it is around the world. And that mercury is one of the toxicants that is involved in autoimmune thyroiditis. And so here we have evidence from a government database that mercury exposure in the United States population is significant enough that 25% of the population could be having symptoms of toxicity, at least from an autoimmune standpoint, as the result of their exposure to mercury through fish. And I'm not going to talk about amalgam fillings because that's a whole nother sticky wicket. It's not that it doesn't cause problems, but that's very hard to diagnose that from a medical standpoint. That mercury doesn't end up in the blood. It ends up in the urine, but there's no direct correlation between having an amalgam filling and having a blood urine level. So I think this is, you know, you wanted data. This is a huge, huge database. Look at this. In 2009, 2010, 8,700 people in this study. You know, when we look at statistics, we always want to try and figure out, as scientists, what is the necessary population that we need to study? How many people do we need to study to get statistical significance? And if you look in medical literature, a huge study is considered 5,000 people. Huge study. Most studies are 200, 300, 400 people. This is almost 9,000 individuals. Repeated, these are not the same individuals every year, it's a different population. So you're really looking at 32,000 individuals studied over the period of 10 years.
Right. Most of my patients, their mercury is hovering in the 90th, 95th, above. They're lucky if it's 75th percentile, and they're coming to me. Remember, my patients have complex chronic illness and they've got autoimmune conditions. And so I'm seeing this in the trenches with the patients. I mean, it's
absolutely.
not.
And I believe because of your locality, being in California, which is more of a fish eating population than Kansas or Indiana or landlocked states, that don't have a lot of water bodies. You are looking at patients that may be exposed through their dietary intake. And one thing I'll mention, just because no one ever talks about this, high fructose corn syrup is a sweetener, right? It is used a lot in a tremendous variety of foods, everything from instant oatmeal to barbecue sauce. I was one of the authors on this paper. We published a study looking at the mercury in high fructose corn syrup. Because of the manufacturing technologies that are used, mercury is actually used in the manufacturing of high fructose corn syrup. It is another dietary item that is contaminated, not on purpose, but contaminated nonetheless with inorganic mercury. And we actually published that study. I worked with a bench researcher at the Food and Drug Administration who was very concerned about this. And we actually sent a sample of high fructose corn syrup into NIST, the National Institute of Standards and Technology, to get it measured. And they actually corroborated that these samples of high fructose corn syrup were contaminated with mercury. So you may also be seeing that, a population that's eating a lot of high fructose corn syrup.
A lot of our patients come from all over the country, actually. So for even the ones who are not from California, still, I'm seeing that. But one thing I'm seeing in California, since a fire season has developed, that started over the past 4 or 5 years. We didn't have fire season before. Now it's every year without fail, unfortunately. I'm seeing mercury levels higher in people than I did before.
So there's a reason for that, as you know, that I guess we have to talk about. So conifers, trees that have needles, like ponderosa pine trees, my area has a lot of ponderosa pine trees, actually will take up mercury from the soil. Well, to start, where does mercury come from? When coal is burned in plants that are making electricity, that coal contains mercury in the earth from, thousands of years of compression. Mercury does exist as a metal in the earth. It's when it's burned, when the coal is burned, that mercury is released, especially in China, where the scrubbers on the electric plants are not that great, the coal burning electric plants, and it actually floats all the way across the Pacific Ocean and lands in California, as well as other parts of the United States and Canada. Conifers will take up that mercury and actually store it in their needles. And an amazing researcher from the University of Washington actually was able to trace the release and movement of mercury from wildfire smoke into the atmosphere. So sadly, I think that our recent spate of wildfire smoke exposure that's happened in, since 2015 across the West has released more airborne mercury, and we do take that in atmospherically. So we do breathe that in, and it does stay in our bodies once we're exposed to it.
Right.
So I think, you brought up a really important, this whole topic now of the complication that all physicians are seeing, whether they deal with it or not, is the complication of daily exposure to toxicants and either the resurgence of what were well-controlled chronic infections or new chronic infections as a result of these exposures because they're immune toxicants, as well as continued exposure to mold and mycotoxins from building.
Right. It's a
building
big, it's a big deal for these patients.